right. Why don't we go ahead and get started? I'd like to introduce our speaker today, Dr. Ray Fabius. Dr. Ray, as he likes to be called, joined us at the start of this pandemic, and we're extremely lucky to have him. Dr. Ray comes to us with more than 40 years of experience in healthcare. He's currently the co-founder of Health Next, a healthcare consultancy for large organizations. He's a physician, a pediatrician, and a population health expert. And he's been serving as a medical advisor to KinderCare throughout this pandemic. I'll let Dr. Ray tell you a little bit more about his amazing credentials, and we'll get going. Over to you, Dr. Ray.
Thank you so much, Heather. I consider myself so fortunate to be able to share thoughts with your audience today to better prepare them for the next stage of the COVID pandemic. I'm also very proud of the fact that I'm able to help KinderCare, not just with servicing the children in their learning centers, but also protecting their teachers and staff and their families. In addition, we're also working hard to provide some guidance, as we are today, with all of the businesses that partner with KinderCare. I should mention that I have come to become an expert in pandemic response, in part because I was the global medical leader of General Electric during the Jack Welch and early Jeff Immelt period. And that included an opportunity to provide safety and protection to over 60,000 GE workers who were in China and Southeast Asia during SARS, which, as many of you know, was the first episode, the first pandemic of a coronavirus. So as a consequence of that experience, I have been recognized as an expert in pandemic response. And in particular, this is not even the first coronavirus that I've had to try to provide some guidance around. We're going to have a full agenda here. As Heather said, we're going to try to get through this information in about 45 minutes so that we can offer you all an opportunity to ask questions. And this is the agenda that we'll go through. So there are certain things that I really want you to know about COVID-19. I know that all of us are concerned because we don't know as much as we would like to know, but we're learning a lot. And I want to convey some of that to you because it's important as you make your decisions at a family level, at a personal level, or at a business level, that you understand science as best we know it. And so I will take you through some of the science and its potential application, especially in the business world. And then we'll bring you up to date on some of the latest pandemic news. We'll talk specifically about returning employees to the office setting. We'll make some comments about how the workplace may actually change permanently, and then a few other considerations. We're going to close by actually providing some guidance to employers around helping families adjust to the reopening, and then we'll open it up to Q&A. Does that sound good, Heather? All right, so what do we know about COVID-19? Well, we know that it is still largely spread by respiratory droplets. So the main way that you get this is by being around somebody too close when they sneeze or cough and they actually have the illness. When we talk about the idea of physical distancing, trying to stay 6 feet away from other people, it's to safeguard you against the potential that somebody actually is COVID-19 positive and they don't cover their mouth or their nose when they sneeze or cough. Even under those circumstances, being that far away can be protective. I do want to also speak specifically about the other way that you can catch this. It's less common, but you can catch this by touching an infected surface and then touching your eyes, your nose, or your mouth with an unclean hand. So, of course, we've been recommending, and you should be reiterating this to your workforce, do not touch your eyes, nose, or mouth with unclean hands. Now, while it's so easy to make that recommendation, there are videos that have been done of people at work, and the analysis shows that we actually touch our nose, mouth, or nose 16 times an hour on average. So this is going to be a very important new health habit for all of us to adopt. If we have an itchy eye or an itchy nose or something's bothering us in our mouth, we should not touch our eyes, nose, or mouth without washing our hands first. If we can do these two things, we can markedly reduce the spread of this virus. If we can keep physical distancing and we can keep our hands clean and away from our face, those are major, major safeguards at the workplace and at home. Now, we do know that there are some asymptomatic cases. Now, again, just to reiterate, that means that we know some people may have the virus in their nose, and we can test for that and find that the virus is in their nose, and they can be without any symptoms. They could be without coughing, without fever. And so that adds some complexity to our story here, because it means that even if you as employers are taking temperatures or asking people to stay home when they're sick, the COVID-19 virus may still be able to get into your workplace by one of your employees coming in, carrying the virus, but not having any symptoms yet. Some of the people who are asymptomatic do develop symptoms and some don't. We don't know yet to what extent somebody who is asymptomatic but has the virus in their nose and the back of their throat can actually spread it. We believe that they can. And so for that reason, even if you are doing temperature taking, it's not going to eliminate the need to engage in physical distancing and frequent hand washing at the workplace. I want you to think about things in a 14-day unit of time. The best experts are recommending that employers not open up their offices generally or broadly, or their workplaces, until there's been inside of your own community 14 consecutive days of decreasing cases. The reason why we use the word, the unit of 14 days is because that's an incubation period. We know that if somebody gets exposed to COVID-19, they can get the infection themselves anywhere from 2 to 14 days later. So when we see 14 straight days of decreasing cases, we know that we have successfully flattened the curve. It's even better, of course, to see 28 days of a flattening of the curve or decreasing cases. But all of you need to balance your need to get started opening up again economically with an understanding of the challenge that you'll have in trying to keep your workplace COVID-free over the reopening period. These 2 points that I have on the slide, I can't say strongly enough. Masks are important. We should continue to use masks inside the workplace, but masks do not replace physical distancing. Don't let any of your employees or family members believe that now, because they're wearing a mask, they can now stand a foot or less away from somebody to have a discussion. And hand sanitizers, as they become more available, should be used liberally. but that does not replace good hand washing. We'll talk a little bit more about that in a few minutes. Lastly, and this is an area that for those of you who know, I've been speaking a lot about this. The data is now very clear that people who are over the age of 55 or people who have chronic conditions are much more likely to have problems with this virus. And so as you're considering bringing your workforce back, I'm suggesting that you consider bringing back the employees in this category perhaps a couple weeks later. This is something that you should speak to your legal counsel about. You need to do this in a way that doesn't discriminate. But I think that recognizing what we know about the virus, providing additional accommodation for people who have chronic conditions or people who are over 55 makes great sense. Well, we know that the pandemic is throughout the United States. We also know that the efforts that we've been engaged in together have started to flatten the curve. It's the reason why states are starting to open up and allow businesses to reopen. The early modeling that was done suggested that if we did not do everything that we've done, including staying at home, there may have been as many as 2.2 million Americans who would have perished. I think we still have a ways to go with this pandemic for sure, but I think it's safe to say that the efforts that we've engaged in together may have saved as many as 1 million lives. So every person who's sequestered, every child, every family member, every adult is a hero in this story. And we should all be very proud of the efforts that we've engaged in together. The data is quite clear. We have saved many, many lives. As you start to decide on opening your own businesses, and as you start to work with other businesses in your community, you'll see that it's important to track how the coronavirus is doing locally in the county where your people work and in the counties where your people live. It is still likely that as we start to reopen, there may be a flare of coronavirus in a county or counties where you have business locations that may require you to close the office a second time. And so you need to have some flexibility, some business continuity, and some ability to track the cases that are happening at the local county level where your business establishment exists. And in addition, you need to have some sense of how the hospitals in those communities are faring. In particular, you want to know whether there are beds available, whether there are ventilators available, whether there are intensive care beds available, because we want to get through this entire pandemic without putting the same kind of stress on the healthcare delivery system that we did initially. If we give the doctors and nurses a chance to take care of the sick people, many, many more of those sick people will survive. But if we are delivering way too many patients to the doctors and nurses at your hospital locally, they won't have the capacity to do the best job necessary to keep your citizens in your county alive. You are hearing a lot about testing right now, and there are two different kinds of testing. One kind of testing looks to see whether or not the virus is present in somebody in their back of their nose or their throat. That's done with a nasal swab. That's the kind of testing that's been done since early in the pandemic. And now you're hearing about the potential to start to take blood from people to see whether or not they have had COVID-19 and have successfully developed antibodies. There are two kinds of tests, and we'll talk a little bit more about that in a minute. It's also important for you to make contact at the local county level with public health to identify a person that you would be calling if somebody at your workplace has a positive COVID-19 case, because the local public health department should be charged with the task of doing contact tracing, but it will be important for you to do that as well, at least for the employees at your workplace. If we can do a good job of identifying cases early and having just those people who had contact with that person who's turned positive go through quarantine, we may be able to prevent a second need for having everybody to sequester at the same time. When you go through that first scenario that I explained, we call that containment. When you can identify each new case, quarantine the contacts, that's called containment. If that doesn't work, like we were not able to do initially, while other countries were, I might add, then you have to move to the second stage, which is mitigation, and mitigation requires the whole population to sequester. So here are some general recommendations for returning to work. And I have mentioned some of these already, but I'll reiterate them. First of all, it's important for you to have an appointed leader, somebody who's accountable for the coordination of all COVID response activities. And that leader shouldn't be having the total burden. And so other members of your organization should be part of a team. And this is true whether or not you have a large or small business. In addition, you should be establishing a way to respond to a positive case. And certainly those of you that are dialing in now that have essential workers, I'm certain that you already have this plan in place. And for those of you who have had your offices closed and you're just looking to reopen, you may want to contact some of the essential businesses in your community to see how they've already handled a case of COVID when it's presented itself at their business location. Of course, part of this infectious disease outbreak plan is to do contact tracing. We're going to talk a little bit more about this perhaps later, but because it's come to mind, I want to share with you that part of your reorganization coming back to work should make it so that if there's any one person in your business who contracts COVID-19, it doesn't knock out a whole department or a whole floor. You should try to make it so that every individual inside your business is working within only a small group or a pod or a modular approach to business, so that at no point, if there's a positive case, will it cause you to have to ask more than another 4 or 5 people to go into quarantine. We've already talked about this idea of perhaps bringing in your employees who are under 40 first or under 50. And we'll talk a little bit more about perhaps the use of serology testing. I think it's important. Many companies have done this already. Many insurers have done this. You should look at ways to make sure that your employees have no financial barriers to COVID-19 testing or treatment. What I mean by that is if somebody needs to get a test for COVID-19 or they need to be treated for COVID-19, they shouldn't have to worry about whether they can afford it or not. Because if they hesitate to actually engage in the healthcare system because of a financial concern, it can impact all of us in a bad way. let's actually talk a little bit about what's happening right now. If your business is functioning reasonably well remotely, I would recommend that you maintain that approach to your business for as long as you can continue to do so with success. Uh, Keeping your employees sequestered at home for a longer period of time will allow for a continuing flattening of the curve and will minimize the exposure that your workforce has to community spread. And we do know that COVID-19 is still in most communities. I do believe that business travel should still be remarkably restricted, even domestically, and in particular for people who are older or have chronic conditions. Um, I don't want you to forget the importance of doing all of the same mitigation strategies that we spoke about at the workplace. Here are some of those examples. We want to make sure that you're disinfecting common workplace areas at least twice a day. Some of those areas are cafeterias, restrooms, elevators, stairwells. It's also important for you to survey your workplace and to eliminate any situation you can where ordinarily multiple people would touch the same surface. So if you can prop doors open instead of making people uh, pull the door handle or the doorknob, that would be a plus. I think you should be placing tissues and hand sanitizers as they're available liberally throughout the workplace. A key part, as I talked about at the beginning, of eliminating the spread of COVID-19 and anything is to make sure people have a tissue to cover their nose and mouth if they have to cough or sneeze. And then that tissue can be immediately disposed of. And then that person can, at a minimum, use hand sanitizers and then at the earliest opportunity, wash their hands. For that reason, as it becomes available, I think businesses should be liberally distributing pocket-sized hand sanitizers. These pocket-sized hand sanitizers that some of you are familiar with can certainly last for a week, maybe even a couple weeks. So you may want to just distribute them on a bi-weekly basis. Every single bathroom in your business should have a poster on it on how to correctly wash your hands. This is, again, a situation where it sounds like perhaps I'm being redundant, or perhaps I'm saying things that everybody understands. But again, there have been very good videos done of people washing their hands in restrooms. And in fact, you know, the data is pretty clear that about 2/3 of women wash their hands appropriately and 1/3 of men. So there's just yet another reason why I need to apologize for my gender. But it in order for you to correctly wash your hands, it's more than just singing the happy birthday song and doing it for 20 minutes. It's making sure that the entire surface of your hand has soap on it. That means in between your fingers. It means the webbing between your thumb and your forefingers. Soap has to be liberally spread across the surface of the palm and the back of the palm. There needs to be complete rinsing of the soap. There needs to be rubbing to make sure that the soap is off all of the surfaces, and then there needs to be complete drying. And for those of you who have left the bathroom with your hands still wet, that would be an indication of not hand washing correctly. In addition, I think the bathrooms and perhaps other places are a great place to provide people with an understanding of the symptoms of COVID-19 and reiterating the preventative measures that we've talked about. The return to the office is going to require some structural changes. I already mentioned this idea of creating smaller groupings, work groups or pods, and trying to make that the lowest number of possible. And that may be better achieved by staggering shifts. So if historically your business was open from 9 to 5, maybe it should be open from 7 to 7, and you split your employees, spreading them out more across the day, or perhaps even creating 2 separate shifts. Understanding that it's quite likely that you will have employees who will come down with the COVID-19 virus, you need to do cross training, especially on essential functions, and you have to review your business continuity plans. Some of you have businesses where there are several offices. Some of them are not located too far away from each other. If perchance one office were to be knocked out, the work perhaps could shift to the next closest office. And that would be something that you would do through reviewing your business continuity plans. You need to have, you need to provide some approach to screening all who enter the workplace, including contractors, potential clients, and other guests. And so we may talk about this a little bit more if time permits. But at a minimum, you should be requiring your people to answer the following 4 questions. Do you have a fever? Yes or no. Do you have a cough? Yes or no. Have you been around anybody who has a fever or cough? Yes or no. Have you been around anybody who you know actually has COVID-19? If the answer to those 4 questions are no, you've gone a very long way toward screening people successfully to enter your workplace. There's debate about whether there's merit in actually taking people's temperature. I actually believe that that function can be shifted to the employee, and that you should be asking the employee to take their temperature every morning, to record that temperature, perhaps on the questionnaire that they fill out each day, and enter the workplace that way. But an alternative is to have every person who's entering the workplace tested for temperature. My concern about that in part is, who are you going to have do that? If you just have one person taking everybody's temperature, you put that one person at pretty considerable risk because they're exposed to all the other people in the workplace. I do want to add, just logistically, it makes sense to limit the entrance and exits of the building that you're in, so that everybody who enters and exits is potentially screened. This next bullet may sound self-ingratiating, but I do believe that the journey that we'll all be on over the next several months with regard to this pandemic will be complicated and challenging. And I have had the great fortune of serving as a physician executive in many companies, large and small. And I do believe that just like most companies have access to an attorney, or larger companies have a chief legal counsel, you should have a chief medical officer if you're a large company, certainly any company over 10 to 20,000 employees. And less than that, you should actually have a physician executive with population health experience available to you to answer what will become complicated questions. Another service that many employers have already made their employees aware of and made available is telemedicine. I'm proud to see how many of my colleagues in the medical field have converted their office practices to include telemedicine service. During this pandemic, I would strongly recommend that employers eliminate copays for telemedicine visits. This is a time where you definitely don't want your employees to go to an urgent center or an emergency room if it's at all possible. And so we should provide liberal access to treating physicians from home through telemedicine. I want to reiterate the importance of still having a relationship with your primary care doctor and important specialists. And we would prefer, and you should encourage your employees to use this telemedicine service to contact doctors who already know them. One of the other areas that's going to be necessary is for you to establish a return to work policy for COVID-19 positive workers. And so if you have someone who had COVID-19 and got sick and now wants to come back to the workplace, what criteria will you use to allow them to come back? The CDC is recommending that employees can return after 7 to 10 days. I would recommend 10 days after symptoms have started, and also at least 3 days where your employee has not had a fever without the use of Tylenol. So both of those criteria need to be met before an employee can come back to work. If it's possible and there's testing available, 2 separate nasal swab tests that show that the virus is no longer present in the nose is an alternative way to assure that your employee can return to work. These other 3 bullets here represent areas that perhaps extend beyond my expertise as a physician, but you do need to communicate to your employees how you're going to treat them if they do get COVID-19, if they have to be quarantined, and determine, for example, whether they still get paid, whether it impacts their sick time, their vacation time, etc. And for those of you that are in businesses that require OSHA reporting, particularly in healthcare, you have to make sure that all the recommendations that you're engaging in are consistent with OSHA requirements. And then lastly, for those of you that have a union representation inside your organization, many of these activities that I'm speaking to may need to be done in collaboration with your union leadership. Let's take a minute or two just to talk about what we may see as a permanent change in the workplace. It will be necessary for your leadership in larger companies who are in charge of facilities, or even in smaller businesses where you're required to provide your own desks and your own floor plans, or in coordination with the ownership of the facility that you may lease. You need to go around with a tape measure and make sure that no 2 chairs where people may sit is any closer than 6 feet apart. Fortunately, with the modular construction that we see nowadays, even in an open floor plan, employees often have a partition that separates them from their co-workers. Those partitions may need to be extended, especially as we start to move into the world of sit-stand desks. So if somebody stands, they're not above the partition. But those partitions can act as natural barriers and protect people from an uncovered cough or sneeze, for example. Clearly, we're going to use more telecommuting and teleconferencing. I think there's going to be more flexible hour arrangements so that we can give employees an opportunity to decide if and when it's necessary for them to meet with other co-workers, and when the work can be successfully completed, let's say from a distance. It's pretty clear that there's going to need to be more frequent cleaning of workplaces, I would say, for the foreseeable future. Many work sites are cleaned twice a week, once a week, uh, but under the present circumstances, it may require that work sites be cleaned uh, once or twice a day. I've dedicated, I'll say the last, if not more, the last 10 years of my career in helping manage the health and well-being of populations. And I've been saying for a very long time to employers how important it is to have a healthy workforce. And I have said in the past, even before COVID-19, that when you have a healthy workforce, then you have employees that are more resistant from getting an infection or acquiring a chronic disease, or they're more resilient if they're healthy to be able to handle an infection or a chronic disease. And if nothing else, COVID-19 has taught us that that is true. People who are generally healthy are faring much better through this pandemic than people who have chronic conditions or even high risk factors like high blood pressure that's not managed well or obesity. So it really is time for all employers to adopt what we're increasingly calling a culture of health and safety as one of the key pillars of their organization, whether you're an employer large or small. One of the things that I learned from my original experience at General Electric was how important information is. Once my employees heard that there was an accountable leader looking out for them and an accountable team working with me to assure their health and safety, and I could communicate with the employees regularly as new information came about or as we developed new procedures or new policies. The workforce was able to calm down. I have used in the past the term information therapy. Whether your company is large or small, it's really important that you effectively communicate to your employees on a regular basis, perhaps even daily, as you are reopening, to convey this message to them that you are truly looking out for their health and safety, that you are utilizing the best scientific information that exists. And for those of you that are doing this, that you're accessing uh, physician executives to help you steer successfully through this COVID pandemic. In order for you to do this effectively, as I've already mentioned, you're going to need to trace the incidence of COVID cases at the county level. Thankfully, this information is available online. And so, as a business, if you're starting to see a location that you've reopened that's really having a considerable uptick in COVID-19 cases, you're going to have to think about shutting that office down for a 14-day period to allow that particular county to return to a flattened curve. Uh, Another area that I have actually spent a good bit of my career on is the connection between financial health and physical health. Sadly, we know that before the coronavirus hit, 58% of Americans had less than $1,000 in the bank. That includes, I'm sure, some of your own employees. So during this period of great, I'll say, physical stress, emotional stress, and financial stress, keep in mind that there are things you can do to help your employees through all three of those components, including helping them with financial health. If your employees need a loan, a swing loan, perhaps there's a way that you can foster an arrangement with a local bank to make something like that happen. as an example. I'm so proud to tell you that we've been working hard here at KinderCare to establish a series of policies and procedures to reopen the learning centers when the county tracking numbers appear to be favorable. This again is to provide safety to the children, the families, the teachers, and all of our employees. As you may know, I'm very proud to tell you that KinderCare has actually remained open in many of their locations during the pandemic to serve the needs of essential workers. And so the children of doctors and nurses and other essential workers have been cared for successfully in our learning centers, even during the most challenging period, the early period of the pandemic. But as we start to see county by county improving in their statistics, we may be able to change the strict way we're handling the pandemic right now within our learning centers. In addition, as is reflected by this particular webinar, KinderCare has a commitment to helping lead the way in the child care industry, establishing the highest standards for health and safety within their centers, and as well as to help all of their business partners. And it would be wrong if we didn't take a few minutes, since we have the attention of employers, to speak specifically about the challenges of families through this new transition of reopening offices. Children, especially young children, do best when they have a structure. And when the schedules change, there is a period of transition that often causes children to be anxious and sometimes even to act out. This is particularly, I'll say, for young children and teenagers. And so I caution all employers to be aware of this, especially recognizing that many school districts have decided to close until September. So as your young family employees return to work, they have to establish some mechanism for childcare. It's helpful for you to be able to provide some guidance for your parents, especially your young parents, so that they know that you're sensitive to this issue, and you can give them some tips to prepare the children for this new transition. So we recommend for sure that you tell your young parents that they should sit down with their children and start to talk about the reopening so that new expectations can be set, and so things can slowly, hopefully, return to normal. I think I'll stop here. Well, let's just make one point, Heather, around a great quote from somebody that I admire a great deal. This is a quote that I have on my desk, and it's a quote that's attributed to Henry Ford. And it says that if I'd asked my customers what they wanted, they would have said a faster horse. This is not a time for you as employers to just be incremental. This is a time where you need to do unprecedented things to exceed your employees and your customers' expectations. they need to know that you're just doing everything you can to keep them healthy and safe. And with that, Heather, I'll turn it over to you to answer some questions.
Great. Thanks, Dr. Ray. Some really good insights there that I think we can all appreciate and learn from. I did get some questions, so I'll tee those up for you here. I think one of them that came through was, can you elaborate on your recommended approach to screening at the workplace entrance? And someone said, for example, should companies be doing temperature checks, even for contractors, and are there any concerns about privacy there?
Great question. I think this is a very important issue that each and every one of you who's attending this session and has employer responsibility needs to tackle. I would say, for starters, that whatever decision you make should be the same for anyone who enters the workplace. The issues of privacy have to be balanced with the issues of fitness for duty. Employers are allowed to obtain information from their employees about their employee if it is crucial to adequately functioning within the workplace and being able to do it in a way that's safe for them and their coworkers. At the same time, we do want to try our best to preserve people's personal health information. And so to the extent that we can, you don't want to be broadcasting, for example, that somebody's not well today. But the alternative, of course, is that if somebody does come down with COVID-19, it's essential for each and every business to know that so that contact tracing can take place. Hopefully, under the assumption that your county public health department has the resources, a good bit of that contact tracing can be done by them. But I am concerned that the public health departments across the country do not have adequate resources. And for that reason, businesses will have to pick up some of that burden. And so it can be done. I think, we used to call this at General Electric, you thread the needle between trying to make sure that you're healthy, that your workplace is healthy and safe, while at the same time doing the best you can to go through the process without disclosing an individual's name, for example.
Yeah, I would imagine, of course, there's legal issues, and it's probably best to make sure you're, confirming with your legal counsel on such things.
Yeah, and we should reiterate the fact that I am not an attorney. I'm a doctor, and yet, I have a considerable amount of experience in this space. So I know that each one of you who represent a business that's listening will be able to develop a policy and procedure that can effectively balance the issues.
Can you speak a little bit about handling elevators? I know at KinderCare we have, we're 16 floors in a building of 16 floors. How do you recommend property managers or companies handle elevators with people touching those buttons multiple times a day?
Yeah, I think the elevator is a great, I'll say, subject to talk about, because it's more than just elevators, but this brings this concept to everybody's attention. There are many spots inside the workplace that are touched by more than one person. That includes stairwell banisters. It includes surfaces in cafeterias or cafes. It certainly includes all bathroom surfaces, and it includes elevator buttons. And it winds up that the elevator button is a particularly uh, um, it's a small area that's touched by a lot of people. So it could easily be a nidus for infection. And for that reason, perhaps every elevator should have next to the buttons that it's important to wash your hands after touching the button, or that at a minimum, use a hand sanitizer. If it's possible, perhaps there could be a hand sanitizer in the elevator or on exiting the elevator in these elevator wells. But I also want to point out, and so for that reason, the elevator button should be wiped down frequently. I mean, I could see good reason to wiping those down perhaps every hour. But in addition, let's talk about the elevator as a confined space. You know, you've heard me say that I still think it's important to stay 6 feet apart from one another. So that certainly means that you can't jam 25 people in an elevator like you may have historically done. And in fact, it may only be possible to be able to safely transport a few people in an elevator at a time, depending on the size of the elevator. Once again, I want to mention that wearing a mask doesn't substitute for physical distancing. So if you think that you can still jam into a subway or an elevator because you have a mask on, that would be a false thinking.
Great, thank you. How can we as employees boost our immune systems to be more resilient to the COVID-19?
Well, Heather, that's a question that just hits me, you know, where I live, and I'm so happy that that question came up. Because as I said earlier, you know, I've dedicated a big portion of my career to trying to convey to people that every day where they take good care of themselves, they increase their resistance to illness and infection, and their resilience if they actually get an illness or infection. So let's start by thinking about how you can take better care of yourself. We know that people should exercise for 30 minutes at a minimum every day. And we know that sitting is the new smoking. And in fact, no one should sit for longer than 45 minutes or an hour, with at least, you know, getting up and walking around for a couple minutes, stretching your legs and sitting back down again. When you sit for very long periods of time, the blood in your legs in particular has a harder time getting up to your heart to recirculate. And that stagnated blood in your legs increases the likelihood of things like blood clots, for example. And it just makes it harder for that blood to go to your liver and your kidneys to get cleaned on a regular basis. So, not being sedentary and exercising at least 30 minutes every day is a very good start. In addition, it's time for us to start to reconsider every single thing that we eat. When people ask me, how can I tell what's healthy and what's not healthy? I tell them, for starters, shop around the periphery of the market. Anything that's natural and raw that you can cook that hasn't been touched by other processes, that is really something that's come from a farm setting to you, is what you should be really buying and eating. If a food product comes in a bag or a box, it's been processed. And generally speaking, when food's been processed, in an effort to try to make it taste as good as it can be, so you'll keep buying that product, there is a significant amount of added salt or sugar or fat. And these things are all not good for you. So we need to try to find ways to enjoy our food without excess salt, which leads to high blood pressure, without excess sugar, which leads to diabetes, and without excess fat, which leads to heart disease. So if we can just eat right and exercise, we can do a great deal to boost our immunity.
Thanks. I love that emphasis on movement and nutrition. So last question, because I think we're almost out of time, but this is a question I think all of us in America are wondering. In your opinion, realistically, when might this pandemic be over?
This is a great question. And of course, it's the most important question. I think for those of you that are employers, you need to be prepared for this to be a much longer process than perhaps was originally conveyed. This reopening of your office is not really the end of the journey. This appears to be a pandemic issue, not unlike other pandemics. That's going to be something that we're going to have to tackle for a considerable period. There are potential game changers that can make our lives much more easy. If we were able to come up with a treatment, particularly a treatment that could make it so that as soon as somebody tests positive for the coronavirus, we could give them a pill or a medication and they could get better in a couple days, that would absolutely be a game changer. Obviously, as everybody's been hearing, developing a vaccine will be a game changer. I'm pretty confident that we will have a vaccine, but it's unlikely to be here before at least January. So without a remarkable therapy or a vaccine, I would say, that we're going to be seeing successive waves of this virus for several months. Let me just comment on one last thing that I think may be helpful to the listening audience, and that is that at the point where the majority of Americans have had COVID-19 and gotten over it and have antibodies, they have given them immunity, that's a sort of a natural way of giving people vaccine. Our best estimates are right now that at the highest level, perhaps 15% of the American population may have already had COVID-19, and we need to get to 60 or 70%. So again, it's going to be a while.
Well, thank you very much, Dr. Ray. This was really, really insightful. I hope our audience agrees. And to the audience, we do have a short survey after. We'd love to hear back from you. This is Heather Zato with KinderCare Marketing signing off. And once again, thanks for having you. Thanks for joining us, Dr. Ray.
Yeah, please, everybody, be safe and be healthy.